The Australian Medical Association's Vice President, Dr. Chris Moy, joins me live now. So, Chris, talk us through what you've released today. It talks about a hospital system under strain in a sort of, I guess, even a normal times sense.
So essentially what this report does, which is called the Public Hospitals Cycle of Crisis, is essentially puts out it's using government data from Bureau of Statistics and Australian Institute of Health and Welfare. Essentially what it says is that with currently hospitals are full and the data is showing that it's not just what we feel, that we're ramping, that we're emergency department waits a long time, you take a long time to get a bed, you have to wait a long time to get elective surgery. Essentially at every stage the health system's choked up and the hospitals are choked up. And that this, first up, is already the case. It's going to get worse. And then right on top of that is COVID, which is just going to tip it over. And I suppose the sort of figures that you see in there, which are really scary, and I'll just give you the sort of figure which is really scary, which is the projections. Yeah. Forget about COVID. Is the sort of number is essentially that at the moment, we already know about 4% of people can't get the bed that they want at the moment. So they're not getting the care. Now, so that means they're going without, they're getting sicker or they're potentially dying. This figure in the next 9 years is going to go up to about 14%. Now, think about that. 14% is about 1.4 million admissions per year, which is equivalent to the entire elective surgery in a year. It means that essentially you've got about, if you need a public hospital bed, you've got about a 1 in 6-7 chance of not getting that bed. And I suppose that's the question is, of those projections, is that the sort of health system we want? And clearly the system isn't working and isn't going to work in the future.
Just to clarify that, I mean, there's triage throughout the health system. It's not going to be, in that sense, 14% of people coming in with a heart attack are going to be turned away, but more so elective type surgeries. And I know they're not, unimportant, and they can be important in the preventive sense as well, but is that the sort of people that will be missing out?
It's either or. I mean, you might not be able to get that urgent bed and you might not be able to get the elective bed that you need for the other sort of things like the elective surgery, which isn't elective. I mean, it's a hip replacement that means that you're going to be able to walk, for example, or it's the cancer therapy. I mean, it's all those things. It is, it's quite a stark reminder, and that's again without COVID.
Chris, so much of this comes down to, when we come to the political debate, funding. Now, we know the federal government upped its contribution from 45 to 50% at the start of COVID for funding for hospitals. If we look at the system right now, New South Wales, on the face of it, considering the COVID cases, seems to be doing pretty well. WA and Queensland are having sort of flashing lights already without any COVID. Do we need to look at this on a state-by-state basis and ask why some states seem to be failing?
Look, what we need to do is look at the data that we've just got in this report and actually say that both the state and federal need to fund the beds and the doctors that they need. We also, I mean, if you're looking at a choke point or a system, you want to look at what's going in. And so you need to fund general practice. And there's a primary care 10-year plan that's out there, which we commend the government on, which is to try and help the general practitioners look after peak patients in the community so they don't have to come in. We need to make sure there's enough beds and doctors in the hospitals. And we also need to make sure that people can get out properly. And at the moment, there's also major choke points in terms of NDIS and aged care about a lot of these individual patients are getting stuck in hospitals. So we need to look at the whole system and not make it a blame game, which unfortunately becomes state and federal blame game.
But you can talk about, wanting to avoid a blame game, but you can also want to say, well, some states are doing better than others and ask why, right? I mean, clearly there are some, if you look at WA, no COVID at all, and they go to this code yellow system for several weeks. That has to be a system that's not working as well as other states, even though they have the same funding arrangement. We should be asking why, right?
Oh, but, you said, OK, so on the one hand, we're totally correct. And I think the same with all the other states that don't have COVID, they're already full. The situation in New South Wales, though, it's going at the moment OK as far as COVID, in a situation where there's good vaccination rates and essentially a lockdown until recently. We're going to see what happens with COVID now, but you've got to remember a lot of their elective surgery and all the other care, which is exactly what it's saying, has been put into the future. It isn't happening. And so it isn't actually working at the moment in New South Wales. And what we need to see is that it's not just about COVID. It's about COVID as well as all the care that you expect the health system to be able to provide.
No, I understand that, and that there's other things going on beyond COVID, but let me put it this way. If WA had the proportionate number of cases that New South Wales has treating of COVID right now, hospital system, ICU, etc., it would not be handling things as well. Is that a fair proposition?
Oh, yeah, absolutely. But to the same degree, what they would do is that they'd just knock out all the elective surgery, and then it might look okay that they're sort of handling the COVID cases. But then again, you'd be in the same boat as what happens in New South Wales at the moment. So essentially, it is the health system being able to continue on into the future, looking after COVID, but look after what they should also be doing, the heart attacks. What it would be crazy is that we've done such a great job so far in Australia of stopping probably about estimated 40,000 deaths, and really great effort by governments all around to stop the 40,000 COVID deaths that would have occurred if we'd done per capita with the UK. But it would be shocking if those deaths turned into essentially deaths in other areas, like heart attacks or other areas, because we didn't have the capacity to look after those things.
Let me finish on an optimistic note, Chris, because we spoke a lot, in particular last year, around COVID before there was a vaccine. All the path out plans were predicated on 80%. We have smashed through that on a national average. We're going to see the two biggest states get well in excess of 90%, it looks like, as well. This is the untold story, I guess, how high this is and how much it's beaten expectations. Our vaccination rates, despite all the scare campaigns and so on, it really should be celebrated.
Oh, yeah, look, I think actually, can I just say, this has been a test of the Australian community. And in general, I think the vast majority of Australians have been amazing, and the vaccination rates are, predicted vaccination rates. And I think they're saying 99% of predicted in ACT of all over 16. I mean, I think that's an extraordinary number. I think really, we hear about the anti-vaxxers. They're a very small component. I think as a community and as far as individuals are concerned, and Australia's actually done really very well when compared to other countries. So I think fantastic job. And the vaccination rates also have been very, very good after. I think the main issue we're going to look back is just the slowness of the start. But ultimately, once we got going, we were amazing in terms of the numbers. Yeah,
look, mistakes made at a federal level. We've spoken before about the messaging on AstraZeneca as well. So not saying it was perfect, but just good to be on the side of where we are now and seeing how high the uptake has been. Dr. Chris Moy, thanks for your time as ever.
It's a pleasure.